classes and go through the syllabus, then it will be more effective rather than virtual. So still I'd like to express few points about the anatomy today. So what is anatomy? Basically, we read biology. So we read chemistry, we read physics in the science. But the same science in the biology, so when you search what kind of biological activities or what kind of biological tissue you want to examine, so that will be divides again the human, animal, plant, like that. So the branch of this particular anatomy is basically a biological science, and this is exactly concerned with the description of body structure of various living organisms. And if I'm using the word anatomy, it doesn't mean only the body which we used to see. The body should dissect. Dissect means to cut the body and observe each and every part of the body. So knowing of each and every tissues, each and every organs in the body, so that type of study we used to call anatomy, right? So basically, again in the anatomy, we classify several things that we will discuss in later on. How this word anatomy derives? As you know, it is from the Greek word anatome. Ana means a body or a body. Body in the Greek or else the Latin, they used to call ana. Ana is nothing but a dead body. Tommy is nothing but to cut. Cut and see the each and every part of the particular body is used to call anatomy, right? Now, anatomy can be studied the whole body, but at a time it is not possible to study the whole body. So that is the reason to study very categorically, we have divided. So else the study system says that we have to divide it in regionally. Regionally means, for example, if we want to see the upper limb completely, the whole limb. So this is a region of upper limb region. Then I want to study about the chest. So that is we used to call thoracic region. So I want to see the abdomen, that is we used to call abdominal region, head and neck region. Like that, several reasons we have. Rather than that, we have systemic. Now the systemic is again divides the system wise. For example, I'll go to the. So this anatomy is classified into as mainly the human anatomy, and other anatomical studies are plant anatomy and animal anatomy. But in the medical science, we are going to deal only about the human anatomy. The human anatomy, especially it involves, especially focus on the most of the focus on the its systemic part. For example, the blood which moves all over the body through the organs, those are organs is used to call circulatory system. Whereas the food which we consume along with the absorption and whatever the process will take, excretion takes place, so that is we used to call digestive system. And the hormonal activities, I think you know it very well, which both the receptor as well as stimulatory. So those hormonal study we used to call endocrine system. And as you know, the bony architecture gives to the shape to the body. Knowing of each and every bone and studying of the bone, actually it is used to call osteology, but system is used to call skeletal system. And along with the circulatory system, we have a special system of that is we used to call lymphatic system. And we have the nervous system, respiratory system, urinary system, reproductive system, and muscular system. So these all study is used to call systemic anatomy. One is regional anatomy, so where we used to study about the particular part of the body. For example, upper limb, lower limb, head and neck, thorax. So that is an regional anatomy. When you come to the systems which are present in the body, for example, digestive, endocrine, skeletal, circulatory. So this type of system used to call anatomical. This is systemic anatomy. Fine. So as we mentioned above, anatomy was preliminarily learned by the dissection only. Dissection is nothing but to cut the body and observe the each and every part of the body, and knowing of those tissues by understanding the particular tissue. So when and who did started this? So the ancient era, that is Greek and Latin, besides the fact that both the words have the same source of anatomy and bodily disciplines of its own, and the word dissection is completely removed. It means the dissection earlier used to call dissection, now they used to call it as anatomy. Why? The anatomy is nothing but an Greek and Latin language. It is fact that it is used to call to cut. Ana is body and Tommy is cut. So they have used this is as anatomy. The ancient Indian system of medicine, anatomy called as Manava Sharira Rachana by Shushruta and Charaka. So they have also studied cutting the body, and they have studied this particular uh, anatomy subject. So this anatomy, as we have classified, the mainly gross anatomy, that is macroscopic, can be seen through naked eyes. Microscopic anatomy can be observed under the microscope. The whatever the tissue of the body, which we detail will discuss. So that is under the microscope what we use to study that particular type of study, or the study is used to call histology. And another is developmental anatomy. Do you know what is meant by developmental anatomy? It is also called embryology. Embryo means the developing baby within the mother womb is used to call embryo, right? Embryo. The whole process of development of a baby within the mother womb, that is used to call developmental anatomy. And along with, we have a human genetics. So the most stress is given to the gross anatomy, microscopic anatomy, and embryology. And part is also covered in the anatomy, that is human anatomy, for you people in the basic, that's for the first year, right? Now, what is there in the gross anatomy? Gross is already macroscopic in nature. So either it may be the systemic or it may be the regional anatomy, that is used to call gross anatomy, right? Now, this macroscopic anatomy defined as the study of an organism structure which are visible to the naked eyes, right? Can be seen through naked eyes. For example, you want to see the deltoid muscle. Where is the deltoid muscle? You want to see the humerus bone. Where is the humerus bone? You want to see the eyeball. You want to see the neck, contents of the inside the neck. So whatever you want to see, you can see through your naked eyes. But if you ask the same thing, I want to see the cells, it is very difficult to see. The reason is they are microscopic in nature. It means the whatever the things which are observed through the naked eyes, so that type of study are to cut that particular tissue, to remove that particular tissue, and to scatter that particular tissue and observe each and every point. Either it may be the bony tissue, either it may be muscular tissue, either it may be the any other tissue which are present within the body. Right? Now, how this particular gross study applicate in the anatomy, gross anatomy. So, study about the different organs. For example, you might heard about the liver, and that eagerness will be there where the liver is situated in the abdomen, how it is situated, how it is interconnected with each other. So that is exactly knowing that part of the gross area. For example, liver is situated somewhere, it's not in whole abdomen, some part of the abdomen. What are the other structure relation with the liver? That is important. As a surgeon, if at all you want to deal with the liver, of course you have to, but you have to keep in mind along with any other structure related to the liver is also important, because you are dealing with the liver, but you are even concerned, more concerned about the other structure which are related to the liver also, like that. So this is how we have to choose the particular organ, different organ, where exactly it is located, and how to identify. For the living anatomy, it is difficult to say these are the structure which are present exactly what. But if you study properly, you can easily locate per examination. You can easily analyze, this is the extension of so and so part, and this is the exactly this is the organ. For that, again, we'll study about the surface anatomy also. In the gross anatomy, we will teach one more, that is surface anatomy. Over the body surface, we can locate what exactly the organ is situated inside the body. That is we used to call surface anatomy in the gross anatomy only. Now, one more thing in the application of gross anatomy, for example, as you know, the angiography. Angiography. What does it mean by angiography? Angio is pertaining to the blood vessel. Graphy is a technique which the scope enters inside the your blood vessel, and it will uh, see the content or any deformities which are present within the blood vessel, right? So that particular study, if at all you are inserting inside the blood vessel, you should have a knowledge of where exactly I have to prick or where you have to insert the catheter. So for that, you should have a knowledge of the NGO or else blood vessel, right? So this whole blood vessel which is moving inside the blood is moving inside the blood vessel, and you are searching for somewhere else there is a plug. So to search that particular plug within the blood system, circulatory system, so that is by the using the technique is used to called angiography. That again, for that you should have well-versed knowledge of what are the blood vessels which are present in the body and how they are interconnected with each other, and how to peripheral to central we have to reach, and how central to periphery we have to reach. One should have that knowledge also. This is again the gross anatomy and application, right? For example, one more important application in the anatomy, if you heard about the X-ray, CT scan, MRI, all these things. So we may not see exactly the organ, but we can see the shadow of that particular organ after taking the radiological film, after capturing this particular magnetic resonance images. So these particular images will see, after taking this particular, you can observe the particular area is either it is normal, either it is abnormal. Normal, we have to study in anatomy. Abnormal, when you go to the particular, when anatomy is shifted to higher or anatomy is decreased more than, then automatically it is used to call an abnormal anatomy. So this abdominal anatomy, it may be the pathology, it may be the microbiological changes will be. So that again we will study in the further study. But in anatomy, you have to study about the normal structure of that particular organ, right? So this is how we have to apply the gross anatomy in the various organs and various part of them. Now moving toward the microscopic anatomy. So here as already I have told, it is difficult to see each and every cells of the body. So there are different techniques by which we adopted to see the small cells. Nowadays, the advancement, we have reached the electron microscope. So for which exactly we can even see the intracellular contents in detail, the mitochondria or any or else RNA, DNA. So there are several things, chromosomes, everything we are able to see. But the study which are you are going to deal in the first year MBBS in anatomy, so we are going to show the systemic and general, whatever the organs which are present, it's there. For example, we have shown exactly over here. So there is an microscope. So under the microscope, you observe this particular chain. So these are the layers which observe exactly over here. So there is a space. This kind of anatomy you will study. The histological anatomy you will study in the microscopic anatomy you will study in the anatomy in the first year. And here you may appreciate, so what are the different types of layers of this particular tissue? What are the content of this particular tissue? How this tissue is connecting with each other, and how we have to differentiate one tissue to another tissue, that you will study in the microscopic anatomy in the first year. So to prepare this particular slide, he's having different types of procedure that is we used to call staining, and different tissues stain with the different types of procedures. So for that reason, we have a whole histotechnic system. This technology will bring you to make a clear picture of that particular cell or tissue, and that particular cell you have to observe whether it is a normal or not. If it is normal, that is a microscopic anatomy. If it is abnormal, then again it goes to the pathology. So this is the reason, if at all you want to identify as a good doctor in, as to identify abnormal thing, you must and should have a sound knowledge of histology. So if you don't have the histology knowledge in the basic, so it is you may difficult to diagnose the abnormality in the second year, or abnormality in the pathological senses. Hence, the microscopic anatomy plays very important role to identify the cellular abnormalities, right? Now, this particular microscopic anatomy, it's even compared with the one system to another system, one organism to another organism, one tissue to another tissue. How definitely, for example, if I am going to identify the whole GI tract of human being is different when compared to other. So that is the reason one must and should have a well-versed knowledge about the what is the normal human histological architecture. So that is most important to identify each and every layer of the histological, each and every cellular elements which are present over the epithelium. So this is, you will study in detail when you come to the class, and will within the practical sessions of the anatomy, right? Histology is completely we will demonstrate and we will explain. The classes will be how the classes according to, I'll explain the how classes will conduct in the. Now, this application of histology, microscopic biological tissues, as I have discussed, the the crucial information, especially when the analysis is for the crucial information about underlying infections or disease. That is the reason I told the pathological analysis is very important, and for that one should have a sound knowledge of histology. If you have a sound knowledge of histology, definitely you can deal with the pathological changes or abnormal cellular tissue. Oh, now the question will rise, the only abnormal things we can identify in the pathological? No. So for example, you might have heard about the forensic science or else forensic medicine. So any abnormal death abnormal death, that also identify the changes in the cellular elements. So for that, we have to collect autopsy tissue and we have to analyze, and we can rule out and exactly search for the or pinpoint the exact cause of the death. So this is how this particular histology will helpful to identify the cause of the death also, right? And as there are nowadays, you have heard about the carcinoma or cancers. For that, again, we will do the biopsies of that particular cell, and we will diagnose under the microscope, and we can predict this is the carcinomatous tissue, or else this is the abnormal benign tumor. Such kind of tissues can be identified under the microscope. For that reason, histology is again plays very vital role in the anatomy. As you know, the developmental anatomy is nothing but an embryology. Embryo is nothing but an mother womb where the developing baby within the mother womb. So that knowledge of 9 months, 9 days, whatever the development of baby takes place within the mother womb, that type of the study or the whole dealing with that particular 9 months, 9 days, or whatever the period of the baby present within the mother womb. So that study we used to call embryology. As you already know, the how the formation or of the embryo and the development categorically we have divided. First 3 months is the first trimester, next 3 months is the second trimester, and last 3 months is used to call third trimester. The trimester wise, again we will teach the week wise or day wise development of the baby, and how this particular growing fetus day wise development along with changes in the systemic and as well as regional changes of particular baby takes place within the mother womb. So that that particular study we can deal with the embryology deal. That deal is used to call embryology. The human genetics, as you know, the chromosome. The genetics means suddenly the word will come chromosome. If I say my features and my whatever the behavior is apparently same with my father, of course, because I'm carrying the all the genes of my parents. So that is the inheritance. So the inheritance study of gene of my parent to me, to my children, my children to. So this kind of study is used to call genetics. So this is nothing but an hereditary information, hereditary information, and how we have to count the genes, particular genes, which which contains the innumerable number of the chromosomes which are present within the body within that particular cell. So that we have a human genetic study also. So that will be deal with the anatomy department within the anatomy department. So this is the very broadly I have spoke about the what are the different types of studies we used to. Here weekly we have the theory classes, around 4 to 5 anatomy classes. The in that we have one class is histology, one class is embryology, and another 3 class will be the gross anatomy. Because around we have to 180 to 200 classes of theory. In that, almost 120 classes of only gross anatomy, around 30-35 the histology classes, and 30-35 your embryology classes will be there. So rather than you will be deal with the anatomy, there is a demonstration, special demonstration of bone and organ, and the dissection practical. The practical will be of 2 hours. The where you have to read before going to the dissection. You have to read, and then you cut the body and reason wise, and you have to identify the each and every part of the. So that is we used to call dissection class daily 2 hours. And rather than that, we have histology practical, and the afternoon session there will be a lab for you. So within that lab, you can see the slides one by one, and you can analyze the different types of systemic histological slides in that, and you can gain the knowledge of histology too. So this is how we have the theory classes, practical classes. Practical classes again divides into the histology and uh, your dissection classes. And again, we have simultaneously tutorials that I'll discuss again in detail. So CBME syllabus in the last, again, I think the most of the people might have discussed about the CBME syllabus, the how exactly the whole medical system syllabus is changed in the last 1 or 2 years, and how to give more knowledge about the medicine to the student and make it easy to understand about the each and every part of the body or else the science. So there are different types of competencies in the particular theory classes. For example, if any organ is given to you, that particular organ anatomical competencies we used to call. For example, how this particular organ is having uh, importance, and how to know this particular, how it can be studied in the different directions of this particular organ, and how it will be delivered by the student during the examination. So these are the different types of competencies we have in the our syllabus. In the one competency I have given an example is used to call ECOM competency, that is attitude, ethics, and communications. So this is one must and should have a knowledge about the EDCOM modules and competencies of theory competencies, SDL classes, and the early exposure to the clinics. So these are the new trials of the education, medical education system, and really it is very wonderful, and you will be enjoy this particular early clinical exposure. You can see the patients in the first year only, and there is a special classes for you to take to the hospital, and a clinical examination chances will be given to you. Now, when you move to the EDCOM module, attitude, ethics, and communication. So this example is the cadaver as our first teacher. Is it the cadaver is your teacher? Of course. This cadaver will teach you, if you read properly, there is a manual is used to call Cunningham manual, so which is written everything in that. So if you read that manual, so you'll come to know that how to do the dissection, which part of the dissection is to start, and how to take the incision up to where we have to cut the body, and how we have to expose the one by one, the skin, superficial fascia, deep fascia, contains each and everything. So that example of the showing the whatever the example is mentioned for the cadaver is a first teacher, means that if you read the Cunningham manual, the whole manual is telling that yes, the body is telling cut me and expose me and see each and every part of mine and remember the things, so that will be helpful for your whole life. Means that is the reason this particular cadaver is teaching you the how you are going to deal in whole your whole life to treat the patient. So that is the reason the science has declared the cadaver as if as our first teacher, right? Now one should, when you go to the cadaver lab, when you see the in the dissection hall, when you see the body, so there will be during particular this particular EDCOM module when we prepare, so you should have a knowledge of background of this particular cadaver. Hence, whether male, female cadaver, what could be the age of this particular cadaver, from where this particular cadaver is bought. So this cadaver is donated by the people to learn the medical science. So they have the great people who donated the body there to teach you the anatomy. If you learn the anatomy properly, so you can easily deliver the things and you can treat patient very beautifully. That is the reason the cadaver is our first teacher. So these are the background things one must and should have a knowledge when we enter inside the dissection hall. And you have to give respect to the cadaver, because as it is told, cadaver is your first teacher. And here, after knowing that particular background of that particular, and by doing the procedure, the competency of the student should be able to, what could be, he is able to identify the male and female body, identify the age of the baby, to identify the what kind of the different location present over the body, and we have to identify each and everything. That is one of the major competencies for you people. And how this learning experience will be, either it is a 1 day or 1 hour, 2 hours, it's not like that. It's a 5 days, 2 hours, and for 1 year you have to. So this complete whatever you are learning in the whole anatomy course of the dissection. So this experience we used to call learning experience, right? The beginning day to end of the year. So daily 2 hours we used to teach the dissection or cadaveric anatomy. So this particular gaining knowledge is used to call learning experience. So what it contains, it may contains about the body, and it may contains the discussion between teacher and you. The daily teacher may not you teach everything. He may assess you how much you have learned about that particular doing dissection, or the how much you have utilized that particular teacher who given chance to cut him. So that is the one more important thing. So what we will do, we analyze you, we teach you, and we properly give the particular shape to understand, to better understand the anatomy. And along with, we have the formative and summative assessment during this particular EdCom module when we prepare. So this is, I have told about the only one EdCom. Like that, we have several EdComs which are present in the every syllabus in the preclinical, as well you go to the paraclinicals too. So this is one example EdCom, the curriculum based medical education study. We have the EdCom competencies that is about. Now the competencies of any theory, for example, any teacher who used to take the class, it is 100% depends upon that particular stipulated subheadings. For example, if you take it heart will be studied in this particular, and that will be given to you the what are the competence, under the competency you are going to study this particular, and in that particular competency, how much one in the anatomy, how much is necessary to, you have to know the heart 100%, how much you have to know about the heart, and how much is know, and how much you must and should know, that is also there in the competencies. And few things can be known, it's not compulsory for you in the first year, it can be known, but related to that particular competency. Like that, there are several subheadings, under that the competency of that particular topic will run, and that competency will be analyzed either in the summative or else the formative assessment. So you have to, when you studied about those competencies, when you have learned about those competencies, now you have to, the how you have gained that particular knowledge of those competencies, and you have to give the assessment of that particular. Now SDL we used to call self-directed learning. Few topics you should study yourself, and you prepare that particular module completely, and try to understand what you have studied, how that module will be. And when you come to the class, the teacher will divide in the 2 to 3 members a group, divide it, and that particular topic he will give some points to you to prepare the particular topic. Now, the teacher may ask the question related to whatever you have prepared related to that topic is. For example, if you have prepared any bone, so teacher may ask about in the bone, where exactly location of this particular bone, how this bone is giving the different actions, and how this particular bone will use attachment to the various muscles, and how this particular muscle gives a variety of movement. So here which covers there is arthrology, it covers the myology, it covers the osteology. So everything will comes under this particular SDL classes, so that you will be expert with the several the basic things of the related to specialty. So that is the reason the student is given free hand to learn their own, discuss among themselves, and deliver whenever the lecture will ask the particular queries about that particular, and hence you will be more exposed with that particular any SDL allotted topics, and that is more beneficial. And if at all you want to, if you not understand that particular topic, again teacher will be there to teach you that particular topic, and you can definitely learn the things better. And the early clinical exposure, so this is the new trend. Actually earlier we used to, clinical importance we used to teach of that particular topic in the within the theory class or else during the practical classes. Now few the important topics of the anatomy they have selected for the, for example, the any important organ which is can be shown early in the first year itself, it is in the clinical side, means they have to take you to the hospital, and they'll brief about this. First, the anatomist will brief about the organ, and you will be taken to the hospital, and you will be exposed with the particular patient, and what kind of, how the examination of that particular organ, how to identify that particular disorder. This kind of the early exposure will be there in the your first year anatomy syllabus. So this is about the all the regional wise or else the syllabus wise anatomy. Now, how we assess the students. So this is about the explaining how we assess the student. So the assessment is the daily interaction with the student and faculty. It's no doubt in that. We will assessing the daily basis and every moment we assess the student. No doubt in that. And there will be a card test weekly once in the dissection hall. And whatever the part we have dissected 1 week, in the one day we used to ask the whole questions of whatever we have dissected or prepared the part. So that is we used to call card test, weekly card test. And when you completely complete one reason or else one system